All right, well, Breast Cancer Awareness Month continues through the month of October, and all this month so far we're bringing you topics on a wide range of issues. And today, planning for a family following a cancer diagnosis. We're joined right now by Dr. John Schnorr, founder of the Coastal Fertility Specialist, and a patient, Laurie Shaw, who was diagnosed with cancer. How are you doing? First things first, how are you doing right now?
Doing great right now. I have a few more treatments of chemo, but I'm doing fantastic.
Good.
Yes,
well, also, at what point in time after that initial diagnosis did this come to mind, planning for a future family?
Everything happened pretty quickly, so I wasn't really sure what to do at first. And Dr. Barron directed me to Dr. Schnorr and said, you know, just ask those questions. Do you want to have children? Do you have children now? And I don't have any children now. So that's maybe like 2 weeks after I got diagnosed. It was all pretty quickly, but had to make some good decisions and went to a great doctor.
Important decisions, yeah. And as a reproductive endocrinologist, how often do you have to coax these cancer patients into thinking, you know, a little bit further down the line?
It's a great question. And so she had a very good breast surgeon who asked the right questions that said, are you thinking about having a family? And by the way, did you know the chemotherapy may actually hurt your ovary or hurt your ability to have a family? Which then centered us so that we could talk about some of the implications for chemotherapy and then options for treatment. And so she chose to freeze some eggs, and frozen eggs can be used in the future after she's done with chemotherapy in a survivor and give her a very good pregnancy rate.
What is that process? What does that whole process entail?
It's a great question. It's about 2 weeks of medication that she took in the form of injections that then got followed up with a minor surgical procedure to take those eggs out and freeze the eggs. And those eggs, once they're frozen, don't age with time. They don't have any negative influence from the chemotherapy. And when she's ready to come back and use her frozen eggs, she gets about a 7% chance of pregnancy per egg that's frozen, and she has about 15 eggs frozen. So she should have a very good chance of pregnancy when she's ready to use them.
Well, that brings a smile to your face.
Absolutely, it does. Absolutely.
What advice, Laura, do you have for people who might find themselves, other women, in a similar type situation? Any advice to pass along to them?
Definitely weigh out your options. I mean, again, it's going to come very quickly, but try your best to slow down. Take someone with you, just in case you may miss something, some very valuable information. And definitely reach out to others if you know someone else that's going through something like that, or even talk with your doctors and see what do other patients go through and what other avenues are there for me to take. Definitely.
Actually, I want to ask about men too real quick.
Another important question. Men who are getting chemotherapy can have harm in how they make sperm, and we can actually freeze sperm before the chemotherapy, and then with that have a good chance of pregnancy once they're done with their chemotherapy.
Got it, okay. And your next chemo session's coming up pretty soon?
It should be we're in November, mid-November. Absolutely.
Okay.
Yeah.
All right. What types of women are good candidates for this?
Yeah, so good candidates would be women who still have regular menstrual cycles, who tend to be less than 40 years of age, are good candidates for freezing eggs before they go through the chemotherapy.
Okay, and what else should any women out there know? Like, after someone is diagnosed, like I said, probably, I can't even imagine, but it would seem to be later down the line that this type of a question would come up. How soon thereafter do women come to see you as a reproductive endocrinologist?
We generally recommend that you actually have your eggs frozen before you actually have any chemotherapy. Some patients come to us after they've had a cycle or two of chemotherapy. By that time, there's already some harm to the ovary. So sooner rather than later is important, and we have some newer techniques that make it so we can freeze the eggs without delaying the chemotherapy.
Right. Well, if you'd like to learn more information as well, we have all the information. We're going to stick it up on our website, too. I'll make sure to do that, and that is the website of Coastal Fertility. Thanks so much for coming in. We appreciate your time, and great luck to you, Laurie.